Good morning. Now let us see our sixth question in our series MCQ4U, where we discuss multiple choice questions mainly in surgery but also in other subjects. Alright, let us look at our question now. All of the following are predisposing factors for breast cancer except A. Family history of breast cancer, B. First child at a younger age, C. Early menarche and late menopause, and D. Nulliparous women. So what do you think is the answer? Yes, the answer is B. Okay, so first child at younger age is not a risk factor. In fact, it is a protective factor. Now let us see how. Let us first see what are the risk factors for breast cancer. So we have a small mnemonic for that: family, cash and cards. Family, cash, cards, and also LMP. So let us see all of them. If a lady has a family history of breast cancer or ovarian cancer or colon or prostate cancer, that makes her a high risk for having breast cancer. C stands for oral contraceptive pills, especially the ones which have got a larger content of estrogen. A stands for age of the person. S stands for sex. Alright, so almost 99% of patients will be females and hardly 1% of people with breast cancer will be males. H stands for hormone replacement therapy, especially if a lady is taking hormone replacement therapy for more than 10 years, that increases her risk for breast cancer. Then C for country. It is more often seen in developed countries as compared to the poorer countries. A for alcohol. Those ladies who have alcohol have a higher chance of developing breast cancer as compared to those ladies who do not have alcohol. R stands for radiation. So if the lady has received radiation to the chest, then there is a higher chance of developing breast cancer. D stands for benign breast diseases. Certain benign breast diseases make breast cancer risk higher. And S stands for socio-economic status. Breast cancer is more often seen in people with higher socio-economic status as compared to lower socio-economic status. L stands for lactation. Now lactation is in fact protective as it breaks the estrogen cycle. M stands for menopause. Now what actually happens in menopause? Well, usually what happens is that the risk of breast cancer increases as the age of the person increases. Alright, the risk of the breast cancer increases as the age of the person increases. But what happens in menopause is that there is a slight plateau and then there is an increase. So this plateau that you are likely to see, this plateau that you see over there, that is known as Clemenson's hook. Okay, Clemenson's hook. Then parity. Higher the number of children, lesser the chance of breast cancer. Also age at first pregnancy. So if a lady's age at first pregnancy is lower, especially below 18 years of age, then the chance of breast cancer decreases. So these are the various risk factors for developing breast cancer. So that answers our question. So if you have liked this video, then you can subscribe to our channel DRAMITDESAI 79 for more such videos. Thank you very much.